Thank you. Well, I want to thank everybody for joining this discussion today. Obviously, a virtual discussion, but nonetheless, I think it'll be a productive one. I know how busy all of you are on this Zoom, whether you're working yourselves to reopen schools or you're teaching, or like me, you're watching your children at home. In fact, we may get Zoom bombed by my 8-year-old or 6-year-old at any minute during the next hour and a half. My wife had to go off to work, and so I am playing dad as well as conducting this morning. So you know, we know, I think my wife and I know how tough this can be, this new normal for our educators, for our schools, for our parents, and for our children. And we wanted to have this Children's Day of Action education event to really highlight some of that work. If it wasn't clear to everyone before this pandemic, I think it's crystal clear right now that our teachers, our administrators, our faculty, and everyone else who makes our children's education possible truly are heroes, everyday heroes. And we owe them a huge debt of gratitude. And I wanted to have this conversation in part to hear directly from you about the challenges you're facing, about your priorities for future federal relief legislation. And I'm going to take those priorities, and that will help inform me as I go back to Washington. We are on what they call 24-hour notice. So really at any time I could be sent back to Washington to vote on a 5th COVID relief bill. We know that we are going back in a couple of weeks for the balance of the month of September to hopefully get that across the finish line one way or the other. And before I turn it over to you, I just wanted to say a few more words about what we have been doing on education over the last year and a half, now closer to 2 years. I have been committed, and I have stated and will continue to state that investment in our education system is critical to our success as a nation, and I'm committed to making sure that all children have access to a quality education. We have to invest in high quality teachers, so critically important. We've got to reduce overcrowded classrooms. We've got to ensure that learning environments are safe and healthy. No teacher should have to pay out of pocket for their supplies, and it's up to federal, state, and local governments to invest in our classrooms, so that's no longer necessary. I also believe that we need comprehensive higher education reform to address the growing student loan debt crisis and to ensure that all young people can afford to go to college. I was proud to co-sponsor and author several provisions of the College Affordability Act, and that's a comprehensive reauthorization of HEA, the Higher Education Act, for students and families to improve the quality of life for colleges and for universities. And I really want to thank my staff. By the way, I know they're on right now. I see Robbie Farewell, who's joining us from our DC office. Thank you, Robbie. I know Kyle Crail-Frolander and Terry Van Horn, and I think probably Eric Mee as well. They're all from our DC, and Terry in Dana Point. They have worked tirelessly to help our educators, our teachers, our families through the pandemic and before the pandemic as well on higher education policy. I was also proud to introduce several bills to improve outcomes for students, including the Higher Education Standards Improvement Act that would provide stronger protections for students if their college or university closes, the Student Loan Contract Act to ensure that students understand the commitment they're making when they take out loans, and the Veteran Service Equity Act, which expands the public service loan forgiveness program for individuals who work at a veteran service organization. And I was pleased to see all of these bills included in the College Affordability Act. That being said, this pandemic, and you all know this, it has turned our education system upside down. And it's all of you, along with our students, who are bearing the brunt of that. So our focus today is on the challenges that you're facing as a result of the pandemic and what you need from the federal government and from our office to get kids back in the classroom safely and effectively. And in order to get our children back in the classroom safely and continue to reopen our country safely, I strongly believe that we need to listen to the science and the public health community. We need to listen to doctors and experts. This shouldn't be about politics or about partisanship. I know that's what you're doing, and I know that is what you'll continue to do. I want to share a little bit more about what Congress has done to support educators and what we still need to do. But before I do that, I want to turn it over to one of our guests, who I know is short on time and needs to drop off the call quickly. Dr. John Lee Evans is a psychologist and serves as board president of the San Diego Unified School District. And as many of you likely know, Dr. Evans has served as a member of the San Diego Unified School Board since 2008, and he taught for over 8 years at the San Diego Community College District Continuing Education Division as an ESL instructor, and also taught psychology at Southwestern College. Dr. Evans, I'm so grateful for all the hard work that you're doing during these unprecedented times, and I want to give you the floor before you have to run. Dr. Evans?
Thank you very much, Congressman Levin, and I'm happy to speak with us both from my point of view as a psychologist in private practice and also as a school board member. Anxiety is a big topic we're looking at. Just recently, Google reported a huge uptick in searches related to anxiety and panic attacks. And the best antidote for anxiety is information. If you're given a diagnosis of cancer, you need to know what type of cancer is it, what stage is it, what are the possible treatment options, rather than just sitting there with the big scary word of cancer. And in this situation, we really need to work at calming our kids and talking to our kids about what's going on. And I think the best way to do that is to ask them what they understand. They've overheard conversations, they see things on TV, but the best way to talk to them is to really find out what they're thinking. And one example, a father said he wanted to go out to a field and play soccer with his daughter, and she said, no, I can't. He said, well, what will happen? And she said, well, I will die. This is like a 10-year-old girl or an 8-year-old girl. And he said, what do you mean? She said, well, I'm in a high-risk group because she had asthma. She said it was his father said it was a very mild case, but he was shocked to find out that this is what she was thinking. So parents really need to ask and then talk to them about it in an age-appropriate way. And we're all feeling stress. And I think one key thing that people really need to look at is our mindfulness activities to kind of bring us back to the present instead of dwelling all the time about what if this and what if that. It's important to focus on exercise, nutrition, sleep, and certainly support, with parents and teachers and counselors. And just one other comment on that, in terms of with the kids, it's really important to monitor, always important to monitor online activities, but now kids are going to be online more than ever. And you wouldn't tell your kid after school, just hang out at 7-Eleven for an hour or two after school. Well, that's what it's like on the internet times 1,000. And so parents are concerned with older kids about issues of privacy, but you really need to be vigilant about what your kids are exposed to. And so now in terms of the schools and working on the school board, the issue is, people are concerned about safety, but we have to balance risk, because there's a risk in terms of kids going back to school, in terms of spreading the virus. But there are also huge risks in terms of not being in school. The academic loss, the loss of social development, the widening of the achievement gap, even things like counselors not being able to pick up on things like child abuse and other things happening in the homes because kids are so isolated. So last June, we made a determination that we wanted to start our classes in person in the fall and September because of these other risks. And we realized there was a financial problem. We said, we're going to start in September, even though we don't have enough money to sustain it in person for the entire year, but they've been out of school too long. And our appeal to the federal government over the summer was, we need more money so we can be open the entire year, not just the beginning of the year. In the meantime, what happened was obviously the virus increased in San Diego, and it wasn't reasonable to be able to open at the beginning of the school year. But there was so much contradictory advice about what to do. So we impaneled a group of expert scientists from epidemiologists and infectious disease experts to help us work on a plan for a reasonable and safe way to open our schools. So we're really using a phased approach. And during this first month, what we're doing is identifying who are the students who are most extremely at risk. And this would include homeless students, some special education students, some English language learners, some low achieving students, and about 10% of the students. And we're going to bring them back part-time on campus to give them some in-person instruction to augment what they're getting online. And then after that, we'll start looking at a small number of elementary students, increasing elementary students, and eventually on to high school. But this is where it's so important for the federal stimulus package that we've been waiting for all summer. We haven't gotten anywhere near what I remember, what we got back in 2008, which was nothing compared to what we're going through now in terms of the financial and social impact. And we've appreciated the support of Congressman Levin. We've had all of the San Diego County Congress people on board in terms of really lobbying hard. We've really identified different national groups between 200 and 350 billion is what's needed, you know, for the equipment, the cost of the cleaning, extra nurses, counselors, all the things we need to do to have our kids back in school and safely. And our message really this week, in fact, right now as we're speaking, Congresswoman Susan Davis and the other two, Scott Peters and Juan Vargas, are all holding a press conference right now at San Diego High School. Hopefully you'll see that on the news tonight, talking about the need for action in the next weeks. For us to successfully open our schools completely, we do need this amount of help. So, you know, it's very different. You know, when this first broke out, airlines, everybody was going belly up. There was immediate stimulus. Ours was a little bit delayed on the financial side, but it's no less monumental at this point. And I just wanted to point out too that the other issue we've been looking at is impact aid. And I want to thank Congressman Levin because he's been very supportive of this. San Diego Unified is very affected by military impact aid, as well as Oceanside and some other districts. And that may or may not be part of the stimulus package, but it is going to be part of the appropriations that will affect our budget for the coming year. So we're really optimistic. We really think we can do things with proper funding to have our kids safely back in school. In the meantime, we're all facing a lot of uncertainty, anxiety. People want to know, well, what date are you going to start phase 2 and what date are you going to start phase 3? And if the virus were under our control, we would set the dates and vote the virus away on the school board. We can't do that. So what we have to do is keep informing our constituents about what is going on, what are the decision factors as far as when we can open. We don't want to have a fast reopening like we did with the bars last summer and then turn around and have to close them back down. In fact, my hope is that the bars and the restaurants would stay closed for an extended period of time. I think it's a lot more important that our kids get back in school. But once again, I want to thank Congressman Levin for his work on the impact aid, for his work on the stimulus package. I think that you know, no matter how much people debate about what sort of stimulus is needed across the country, it's hard to say on a bipartisan basis that we don't need our schools open, and they can't be fully open without the proper funding. So I really appreciate your support, and I understand the difficulties everybody is facing, the principals, the teachers, the PTA people, everybody working together on this. So thanks a lot for letting me share about this.
Well, thank you very much, Dr. Evans, for sharing your perspective, for all your excellent work. I know how busy you have been, so I really appreciate you taking the time to speak with us all this morning, and obviously let us know in the weeks and months ahead how we can be of most assistance. And your words were a particularly good segue to what I wanted to speak about next for a few minutes, which is what we've been doing in Washington, D.C. I'm sure you all are aware that we now have had 4 bipartisan bills since the beginning of March on COVID-19, all the way from March the 6th, $8 billion for a vaccine, and then the middle of March, the Families First bill that was about a $200 billion effort, included emergency sick leave, nutrition assistance, and then at the end of March, the CARES Act, the $2.2 trillion bill, which included quite a bit of money for K through 12 and higher ed, but even at the time, I remember the discussions were not enough money for higher ed and for K through 12. Also money for state and local government, but again, the belief was not enough and not flexible enough. Remember, California went from a $21 billion surplus to a $54 billion deficit seemingly overnight. We got in California about $15 billion from the CARES Act, but that money was allocated quickly, and smaller cities in particular, such as in our congressional district, received zero in direct financial assistance. So we needed to, obviously do more. We passed now over 3 months ago the HEROES Act. This was a bill that was passed in the middle of May, and we sent it to the Senate, and unfortunately that's where it has been languishing ever since. And I had felt that it was going to be very difficult to negotiate without a realistic counteroffer in the Senate. And they didn't provide a counteroffer all through May, June, July, or August. At the end of August, they did introduce, or at least have a discussion around something called the HEALS Act. That was a bill that Mitch McConnell had championed, about a $1 trillion bill. But the problem with that bill is it didn't get the support necessary to get 51 votes in the Senate. So it's very tough to negotiate without a reasonable counteroffer. And that's how the first, second, and third, and fourth bills went, is we had an offer, a proposal. The Senate had a counter proposal, or in one instance, I think the Senate had the initial offer, the House had the counter proposal. But this time there has been no counteroffer now, going on over 100 days. And our virus, the challenges have certainly not been alleviated in the way that we had hoped during that time. You might remember McConnell and others basically said, well, let's just wait this out. Let's take a pause and hopefully the virus will disappear. And clearly it has not. I'd like to think that if we'd had the resources in the HEROES Act, as we passed back in May, we would be far better equipped right now to reopen schools in a safe manner. The folks on this Zoom would have the resources that would give them the greater confidence. And the schools, instead of that, the schools are being asked to do more with less, and the Senate didn't take any action again in May and June, July, and August, leaving a lot of our school districts, a lot of our educators in the dark. And that's where we stand, unfortunately, today. I think that everyone understands the gravity of the situation, the lives and the livelihoods that are at stake, and the life of our democracy as well. But, again, there is some sign for optimism. Earlier today, although it's cautious optimism, earlier today we saw a draft, and I don't know whether it's made its way into the public yet or into the news, but the Senate does have a bill that they're set to introduce maybe as soon as today, I don't know, or next week. It's a $500 billion bill. It doesn't go nearly far enough, but at least it's a counteroffer that might actually get the 51 votes in the Senate. So as I mentioned before, I'm on what they call 24-hour notice, meaning that at any time, if we feel that negotiations have sufficiently advanced, I will fly back and I will be part of those negotiations. And what I hear today helps inform me during that process. But we're still pretty far apart. And one of the areas where we're pretty far apart is on funding for state and local government. As I mentioned, there was $150 billion in the CARES Act for state and local government. Not enough, unfortunately, for the deep hit to things like transit occupancy taxes, tourism-derived revenue. That's so critically important in a district like ours. The CARES Act could only be used, the funding could only be used for direct COVID-related expenses. So one of the things we insist on is in another round of funding for state and local, that it also be able to be used for the revenue recovery. And also that smaller cities such as Oceanside, Carlsbad, Vista, Encinitas, Solana Beach, Del Mar, San Juan Capistrano, Dana Point, and San Clemente, all the cities in my district, be able to use the money, not just the big cities. So we're fighting for that, and that made it into our HEROES Act in May. And look, the other important thing for you all to know is that the HEROES Act included significant resources for schools. and not resources that were tied to a forced reopening, but rather resources that are connected to allow those local school districts, because not everywhere in the United States is identical in terms of its readiness to reopen in person. Some places with wider community spread, higher infection rate, are less able to do that. Other places that are doing better are more able to do that. So we wanted that flexibility. And the HEROES Act had $90 billion for grants to states to support statewide and local funding for elementary and secondary education and public post-secondary institutions. Flexible funding that can be used for any of the following: costs associated with making up instructional time, including teacher, school leader, and classified school employee personnel costs, costs for providing school-based supports for impacted students, families, and staff, including counseling, mental health services, family engagement efforts, and the coordination of physical health services, costs associated with sanitation and cleaning for schools and school transportation, professional development for school-based staff on trauma-informed care to restore the learning environment, purchasing educational technology, including assistive technology that aids in regular and substantive interactions between students and their classroom instructor, coordination efforts between state educational agencies and public health departments for emergency planning, response, and much more. So that flexibility is really key. The HEROES Act also includes $100 billion for low-income renters. That emergency rental assistance is so critically important, and we're seeing what the CDC is trying to do. We see what the state of California is doing with regard to delaying evictions, but we've got to do all we can, not only to delay, but also to help people who are in their time of need right now to be able to make it through this awful period. And look, the HEROES Act, it was an 1,800-page, $3 trillion bill. And I don't think that the expectation was that the Senate was going to support every word or every page or even every idea or concept. But what we did expect, again, was that counter offer. And hopefully we'll see that very soon. And rather than being at impasse, we'll be able to negotiate and get something done. And we have already said, the House Democrats have said, that we will meet them in the middle. We will meet them in the middle. And here's the thing, if you're 5 steps apart in a negotiation, we're willing to take 3, but they better take 2. They better take 2 towards us. We're not gonna take all 5 steps. We're not going to completely abdicate our responsibilities and our values. And so that's where we've been now for quite some time. And we wanna see this done. We wanna see this get over the finish line. Again, we're not here to have a debate about whether or not schools should be open. I'm listening to public health experts to guide those decisions. And I know you're probably growing tired of that debate too, but we're here to figure out what you need to keep kids safe and to keep educating effectively during this time. With that, I want to turn it over to another wonderful guest, an elementary school teacher in the Encinitas Unified School District and a trustee of the Oceanside Unified School District, Mr. Eric Joyce. Eric, it is great to see you. Eric has been a special education teacher and specialist in the Encinitas Union School District since 2012. He's been serving on the Oceanside Unified School District elected school board since 2018. Eric, I know how busy you are. Thank you for your dedication to teaching. Thank you for taking the time to join us and to share your thoughts and your experiences. The floor is yours.
Good morning, Congressman Levin and everyone who's joining us. I want to say thank you, first of all, for setting up this time and our platform to discuss the foundation of society, which is public schools. And we all know that you hold it as an important piece of what we need to move forward on. I want to say also, it's unfortunate to hear that we have to ask our representatives to take 2 steps forward when we should be hand in hand taking steps forward for the people of our country and not having to get into the politics game on that. But we appreciate all the advocacy you're doing, and we're right there behind you. So my first lens to talk about today is as a teacher, right? So that's my day-to-day, that's the world I live in. And the first thing I want to say to everyone, and they're probably well aware of it, is that teachers are tired. We are tired, just like the rest of the country is tired. We are ourselves dealing with our families and the pandemic and the stressors that our previous guest from San Diego Unified brought up. We are staying up late trying to make sure that our kids are counted, and we are getting up early to try and make sure that the materials are ready for them. And in between, we get to spend a few minutes with our own children. So we're tired. And and to that end, we look at what we can do in the classroom to make connections, because school is built on the connections we make with our students. So engagement being the biggest factor, the biggest thing that we're thinking about, that I'm thinking about with my kids, because you can't learn if you're not engaged. So we focus a lot on engagement. In a classroom setting, in a regular setting that's non-COVID, that's non-distance, I use all kinds of tricks to keep a student engaged. We do lots of exercises in between learning. We do lots of physical and multimodal learning. And like any good teacher, I use timers to make sure that we get lots of breaks. But in a distance learning environment, in a COVID learning environment, and crisis learning environment, those are all cut away, and they're much harder to utilize with our student population. So as a teacher, that's one of my biggest concerns and one of my biggest focuses. Another concern that we are thinking about and working on is the hard to reach kids. We have students that come to school who are already hard to reach, who through whatever trauma in their life or through whatever learning challenges that they have and they bring with them, they're tough to make connections with. And we specialize in making those connections with those students. When we add this gulf of distance and we add this layer of stress that comes along with living in a pandemic, those hard to reach kids become almost impossible to reach. And so as a teacher, we take it very personally to take the time and do everything we can to reach out and make those connections. And so when you think about the workload of a teacher, yes, it has a lot to do with curriculum and learning your ABCs and getting the knowledge in, but it also has a lot to do with reaching kids where they are. And so that has been a particular challenge in this time. And the third thing I want to talk about is school as a sanctuary. So as a teacher, I know that school is not these set of walls that we live in. It's this place and this feeling that kids get when they come in, and sometimes they can let down all of the stressors that they have on the outside world. So we build schools to be these sanctuaries for students. And right now we're having to bring that sanctuary to their own living room, to their own homes. And so our providing sanctuary is really letting them know that we care about them, letting them know that they matter to us, and that we can still find a way to build a learning community and a community where we can be together, no matter whether we're online or whether we're going to eventually be in a hybrid model or whatever learning model we're in. We're making sure that that sanctuary is still in place. So then I switch my board hat on, and it's a whole nother set of things to think about. Making decisions as a board member often comes with recognizing that the decisions we make are going to impact our communities in vastly different ways. This pandemic itself has affected communities in vastly different ways. The job losses that came along with the pandemic has affected our communities in vastly different ways. And so one of the biggest challenges of being a board member right now is being able to stay in contact with those community members who might be more isolated, who might be overtaxed and overburdened by either having children at home and not having care for them, or having to work many jobs to make ends meet and to put food on the table. How do we stay in contact with that community when we are all operating at a 10 already? So trying to make sure that as a board member, I can hear out my community And I know in Oceanside, we have lots of community members who do use the internet, who use these newer forms of communication, but we also have lots who don't, through just a lack of resource or through a lack of time because of work. There are lots of families that we need to be at their front doorstep to hear about their needs. So that's another challenge with being a board member in this time. So when I think about all of our decisions that we need to make, I try and run it through an equity lens every time. And when I run through the decision-making tree on bringing kids back to campus and where we put resources right now, I have to run it through the equity lens, which is which students need the resources the most right now. And when I think about distance learning in particular, the first ones that come to mind are students with special needs. Who is lacking the access to learning right now the most? And it's the students with special needs. It's the students that are homeless or foster youth. It's the students with English who are still learning the English language and whose families may not be able to communicate with their teacher as effectively when they can only do it over the phone, when they can only do it over Zoom. There are tremendous resources that we need to put into all of these populations. And these populations are, of course, people, to reach them and to make sure that they have access to learning during this crisis. And so I try to run through everything that we talk about, whether it be budget, whether we talk about communications, whether we're talking about curriculum and management, whether we're talking about social emotional investments, where are counselors going? And whenever you put things through the equity lens, they come out the other side not equal at every place. And sometimes that can be hard to explain, but it's on us. It's our responsibility to explain to the community why that is the right thing to do. So I realize I'm running out of time, and you asked me to talk about schools, which you know I could do all day long. So I'll wrap it up with investment. Many of our districts were frankly starting from behind. I have my foot in 2 districts right now, right? And I teach in a district that was already one-to-one years before we stepped into a pandemic. The students were familiar with the technology, the teachers were familiar with the apps. The ramp to getting started into distance learning in certain districts was a lot less steep. Now, that doesn't mean they're facing their own challenges and my students aren't facing their own challenges. But in places like Oceanside, where we didn't already have one-to-one technology because of chronic underinvestment in education, the ramp is steep. And the equity lens from an investment standpoint, from an investment from the government standpoint, should reflect that. So I ask that we look at investing with equity in mind, that we invest in special education. And I want to thank you, Congressman Levin, for signing on to fully fund special education. That's a huge a piece of my heart. And I know that you take it very seriously and you signed on to that bill early on. I wanted to talk about really quickly investing in high-speed internet for all students. Now, that doesn't just mean that we ask. Currently, we're asking our cable companies to provide that. And given that that's the situation, there ends up being a lot of barriers to families, whether it be providing ID or providing proof of where they live. If you're homeless, it's hard to provide a proof of where you live to the cable company to get your access to internet. It's also a barrier to people who already have internet, but need higher speed internet. So learning in those cases is not free right now, and that's an investment that we absolutely need. And then the last place that I would ask for an investment in is science education. I think we need to understand as a society that science should be driving so many of our decisions. And right now it's extremely poignant, right? But people have been making this case for years and decades, that science is not a number of facts, it's a way of thinking about the world and considering information. And if we can invest in science early and make it just as essential as all the other, as math and reading and writing, then we'll have a society that's prepared to make decisions in an epidemic, in these crisis situations. and they won't be vulnerable to the disillusionment and the frankly, the scare tactics that are put out by politically motivated individuals in power. So once again, thank you, thank you, thank you. Please invest in science, high-speed internet, and education, and special education.
Thank you very much, Eric. I agree with everything you just said, and in particular, you should know that with regard to full funding of IDEA, I had a call along with my dear friend Jared Huffman and a few others. I think there were 4 of us on the call with Majority Leader Hoyer just last week, asking about how we get that to move potentially in September. I know that the difficulty is, of course, coming up with a pay for and outlining how we pay for it. But my point is, in this environment where we're spending such significant sums, and we know because in all my conversations with superintendents, we know that IDEA funding would go so far in helping them that we need to be thinking of it in the broader context of COVID and sort of this new reality for our schools and our educators. So I think that was very well received. With regard to high-speed internet, I couldn't agree with you more. 21.3 million Americans lack access to high-speed internet. Broadband access was something that we fought for and included in the HEROES Act. And look, it's pretty hard to have meetings like this or to work from home or study from home if you don't have access to high-speed internet. I mean, last month we got our thing from our cable company saying, hey, you're about out of your, however much your data is, you've about used it up. And I assume that we're not the only ones that have gotten those types of messages. So it's prohibitively expensive for some people to have high-speed access like this. But I also wanted to say a couple of our guests. I know Dr. Patterson, Dr. Doyle have a hard stop at 11 a.m. So I want to go for both of the doctors, and then I'm going to go to Roberto Rodriguez after the 2 doctors, and then we'll keep going with all the rest of our speakers. But I want to be very respectful of Dr. Patterson and of Dr. Doyle. Dr. Patterson is the Chief Nurse Officer and Vice President of Patient Care Services at an amazing institution, the Children's Hospital of Orange County, known as CHOC by all. Just such incredible work that you do. Before her 21-year tenure at CHOC, she served as Clinical Director of Pediatrics at City of Hope National Medical Center, another amazing institution. Dr. Patterson, thank you for all of your work to provide care for the children in our communities, and I'd love to get your thoughts and perspective of what you're seeing and hearing and experiencing right now.
Of course. Thank you. Thank you, Congressman Levin. I really appreciate being invited and happy to talk about what we're seeing at CHOC. So I do have some slides. Do we have them up?
I think we're doing it. There you go.
Okay, we can go to the next slide. Thanks. And I'll try to get through this fairly fast and see if we can make up some time. So I just always like to start with our Orange County numbers. So as of September 1st, Monday, we had almost 49,000 cases in Orange County, with now over 1,000 deaths. And we watch this very carefully at CHOC. We know that we have to look at trends and we have to be prepared to take care of all the kids in Orange County and outside regions. So we're preparing for the long haul. We know that in July in the nation, we had a peak and hospitalizations followed that peak, including at CHOC. It's come down nicely, and I think we're all preparing and trying to be really optimistic that things will get back to normal. But we still have kids in the hospital. You know, what we do know at this point is we're in for a pretty difficult winter. I know that there is certainly a lot of talk in media about COVID and flu. We talk at CHOC about RSV, the respiratory virus that everybody seems to get. Neither are going away because of the community transmission. So what we do know and what we need to be vigilant at is really around the hand hygiene. The respiratory etiquette is what we call it, of sneezing into your elbow and not your hand, etc., coughing. Masks all the time when out. physical distancing, and of course cleaning after every interaction. And so I sit here and listen to all of the challenges that you're going to have once we get kids back to school. And I hope that you all just think about those really important things. Next slide, please. We also know that the percentage of children and young adults with COVID hasn't really changed. It's remained stable at about 21% over the last several months. And so, you know, it's higher than some people talk about. And we have seen quite a few children here at Chalk. Next slide. So this is really Chalk numbers. You can see in the right lower corner, we've tested more than 11,000 children with a positive rate of 8.7%. We have had, as of yesterday, 982 positive children, and 112 of those patients have been hospitalized. 1/3 of them in our ICU, very, very ill. And so you can see the age groups, you can see where we're testing. We test in our outpatient clinics, of course, coming through the emergency department. Our OEC is our outpatient evaluation centers. Those are the 2 tents we've put up. We're testing at our sister hospital, Chalk at Mission down south. They've seen 6 patients in the hospital. Next slide. So we really want to talk about a little bit of the guidelines. Our top 5 symptoms haven't changed, and we're seeing patients come in with fever, cough, sore throat, headache, congestion. Does that sound familiar? It sounds like everything, right? It sounds like the flu. It sounds like a respiratory virus. We know that we are going to have to manage the flu season management. The one thing I can say is get your flu shot before October. We all need to be doing that. When you do see students, if they are symptomatic at all, we need to send them home. If time in quarantine, if they are exposed by a household member, they need to be home for 14 days. If they are positive, so they go get tested, they need to be home for 10 days. And there is some more recommendations around that. And the return to school, CDC is now advising against retesting, as do we. We have, you know, every day things change with COVID. Every day the recommendations and guidelines change. We have a command center here that we started on March 16th. And I am in the command center every day with my team, trying to manage all the changes, updating algorithms, policies, just to make sure everybody's safe. But right now we are advising against retesting because there is evidence that once you have COVID, it can stay with you for several months. And in fact, when you do another nasal swab, you can they might grab a little bit of that RNA, not really contagious, but still looking positive. And so again, I'm being very gray because every situation's a little bit different, but we have had kids who are positive, then test negative, and then test positive again. So that just puts a whole new layer of complexity on COVID. Next slide, please. So what have we learned? We thought that maybe you'd like to hear some of the lessons we've learned. We're in month 6 of COVID, dealing with children with COVID and parents every single day. So our lessons are masks are crucial. And I know you hear that over and over every day, but they are crucial. Our exposure guideline is really, we have an exposure if you are within 6 feet of another person for greater than 15 minutes with neither wearing a mask. So when you're thinking about kids walking through the hallway, one takes down a mask and walks past another, that is not considered an exposure here at Chalk. So really need to understand your guidelines of exposure. We limit the number of individuals on site. Within 1 week, we had 1,000 of our employees working remotely, and we'd really never done that before. And so, you know, less people, less risk of exposure. Health screening, of course, in the hospital, we screen everybody. Every associate gets screened every day at the door, and that's with screening questions that I'm sure you've all gone through somewhere. And we get our temperature taken before we come in. The first week that we did this, we sent home a lot of people. And so it is, our eyes are wide open when it comes to health screening. Restructured logistics to ensure physical distancing. So we went through every office, every lobby, every break room, and had to move furniture out, signage, helping people understand, especially in the break rooms, that is when you're eating and your masks are down. That is the biggest exposure risk anybody has. So think about that. I know some of you have employees already on the campus, on campuses. So you should be thinking about that. And a centralized information source. So that's our command center. We are open every day, and we take the phone home. We have what we call a source of truth that we send all new information out once a week to everybody in the organization. Everybody watches for it and looks for it. And we also put source of truth nurses in place for the different patient care areas to answer questions, because you've all said it. There is so much anxiety in the world right now. Everybody coming in here is anxious. As soon as we have a positive patient, the anxiety goes to the ceiling. We know how to do this. We do this every day. COVID's not the first in virus that we've had to protect ourselves from when we're taking care of that child, but there's still a lot of anxiety, and it's taken a lot of resources to really manage that anxiety. Next slide, please. So we needed to rewrite a lot of new policies and processes, and that's complex. So you need to think about what group's doing that, how long it takes. Certainly, I'm sure there's a lot of layers in the school districts. Effective and frequent communication. So again, they're stressed. We also do town halls, which they love, to talk about certain topics around COVID, and we record them. So that's an idea for all of you. Human errors and the unexpected will happen. We've had several, of course. They're all of our lessons. We put up a tent in Irvine, did everything we can to make sure it would stay there. The first wind came up and it blew down. And so we had to do it again. And so things like that are going to happen. We just know it. And to be really patient with each other, because this is just an unknown time for all of us. And we do really hard things at Chalk aside from COVID. So now we're just layering COVID on top of that. COVID-19 environment guidelines and information is constantly changing. I talked about that. So just be prepared to be adaptable. That the change theories are important. We need to change fatigue, and everybody around you is real. And I've already heard that this morning from a couple of you, but it is very, very real when you have COVID all around you and trying to keep everybody safe. Next slide. I think that was my last slide. Yes. And so I can stay online till 11 if there's questions, but I'm with you. I'm optimistic, and hope we can get some kids back, to campus doing what you all do best. And we're here to help at Chalk. So thank you.
Thank you so much, Dr. Patterson. And I think we all can offer our thanks to you and to Chalk for all the great work you do for our children, not just now during this time of crisis, but in general. This is an amazing institution, and we are grateful for all the work of all the personnel there, and just keep at it and let us know how we can help.
Of course, thank you.
With that, I want to also introduce Dr. Matt Doyle, another very, very busy member of our community. Dr. Doyle is superintendent of the Vista Unified School District. He's executive director of the International Center for Educational Research. And before assuming the position as superintendent, he spent 31 years in education as a teacher, site administrator, district administrator, and county administrator. I think that about covers all the things you can administer. But Dr. Doyle, we're so grateful for your leadership. I know you have a hard stop at 11, and we'd love to hear from you, what you're seeing, what you're experiencing, and how we can help.
Excellent, excellent. Well, thank you for having me, Congressman Levin. And I want to thank you for all the many events you've been having. You're listening, and that's what we need a congressman to do. So thank you, appreciate it.
Thank you.
So I'm one of 42 superintendents in the county of San Diego. And one of the great kind of outcomes of a difficult situation with COVID is these 42 superintendents have come closer together. So we meet every week, we talk about this. And what I wanted to do is outline 7 key areas that are new to our job description this year that we didn't have in the past as a result of COVID. And then maybe spend 2 or 3 minutes drilling into our ask in terms of what you can do back in DC around things we need, challenges we have that we're not able to solve. So those 7 areas, the first area is this mountain of data that superintendents and their teams have to sift through on a daily basis that Dr. Patterson just went over. Essential, we need to know it, we need to understand it, and our staff needs to understand it as we respond. It's just amazing the amount of data as it relates to students and health. The other mountain of information that we have to sift through, it's essential but very difficult, are all the guidance documents we receive. We receive guidance documents from the California Department of Education. We receive guidance documents from the federal government, CDC and others, and we receive guidance documents from the county Health and Human Services, Dr. Wilma Wooten. They're fantastic documents, but super complex and very difficult to manage as we prepare to begin a school year. We also have to engage the community. The community is part of the educational process, so we want to have authentic opportunities to engage our community in ongoing conversations. And so a challenge, but an important challenge that we're embracing as superintendents across the county. And then, of course, communication. How do we communicate what we're doing, why we're doing it, and how people's feedback is influencing those decisions? Super important. And I think Eric pointed out that when we communicate, we can't just use typical communication avenues. We have to think of a variety of ways to communicate to our public, because not everyone's on Twitter, not everyone's reading their emails. So it's super challenging. In many of the instances, especially in Vista, we have to do it in multiple languages. Super big challenge. We're up for it, and we're following through on it, but these are things that we weren't kind of pressed with in the past. And then getting down to the challenges that we have today and what I'll leave you with. Preparation. So getting prepared for the launch of a school year. Many of my colleagues have already launched their school year. Our first day is September 8th next week. And that preparation, and when you think about preparation, it's preparation for health and safety. Are we getting the PPEs, the personal protective equipment, to the right people? Do we have enough? Do they know how to use it? And then are we preparing the physical adjustments to our school? A couple examples of things that we didn't have to do in the past, but that we have to do now. Putting sneeze guards in the office so the staff feels protected. Making sure our classrooms are fully cleaned. Developing a new protocol for sterilizing and ensuring our classrooms don't have anything related to COVID on a daily basis. Do we have to order new supplies or new mechanisms in our classroom to clean them? Many of our districts have fogging machines now, so they can go in and sterilize a classroom in 5 minutes or less. All the various preparations that are needed in a school district are challenging for us because we're also trying to prepare for education and our students, ordering books and supplies and making sure teachers have what they need, planning professional development. But with regard to challenges, and again, I'll just spend a couple of minutes on challenges. There are a variety of challenges we know, but I can really boil them down to 3, that if you could bring this back to Washington, D.C., I guarantee you it would uplift all 42 school districts in San Diego County. There's other challenges, but I just want to focus on 3. Air filtration. Every classroom in this county, in our school district in this county, has a different type of air filtration system because they were built at different times. Even if you have a newer school district, it's maddening for a superintendent and our staff to figure out how can we manage to upgrade the air filtration system so we can reassure our teachers, most importantly, and our students, that we're trying to get clean air in. And here's an interesting caveat to that I didn't think about until we drilled into this. Many of our newer classrooms, we have a number of new schools, have terrible air filtration that's designed for COVID because the windows don't open. It was designed specifically for that purpose because we live in Southern California. And when you think about it, it makes sense. Air conditioning, we need to keep classrooms cool. So let's build classrooms where the windows don't open so we can make sure the classrooms stay cool, right? Completely antithetical to what we're trying to do with the COVID-19. And so that's a huge challenge that we're all kind of racking our brain to try to resolve. We have some simple workarounds, but in order to really resolve it, Congressman Levin, we need expertise and we need funding to figure that one out. The second one, staffing. Social distancing is huge. It's all over the place. We all want to comply with social distancing. How can we do that if we don't have enough teachers to make it happen? Now, we're fortunate in Vista where we have a number of empty classrooms because we've experienced declining enrollment. We could easily fill those classrooms if we had the funding to hire more teachers. Now, we've hired 20 additional teachers, but we would need in excess of 100 more teachers to do it right. We care about our teachers, we care about our staff, we want to keep them safe. But in order to do that, we need more funding to make it happen. And we know there are teachers out there that are waiting to be hired. They have the requisite abilities, they have the credentials, we can get them in, but we need that support. And then the third and last one, perhaps the one that's the most frustrating for many superintendents, we've talked about this more than anything else, is childcare. Our staff, our teachers, our office staff, our instructional assistants, they have children of their own. We care about their children. How can we make sure that we keep them safe? And how can we provide a service to them? They're providing a service to our community. They're putting themselves in harm's way. How can we take care of their children while they provide a service to us? And every time we try to develop a methodology for providing childcare, we can't follow through on it because it's not legal. We need to adjust the regulations, at least minimally now, temporarily, so districts can create their own childcare programs, so we can get these teachers and these staff members who are heroes. They're trying to do the right work. How can we support them with their own children and provide safe, appropriate, following all the CDPH guidelines childcare so they can deliver on it? And then I'll just add the last funding. So the three areas are air filtration, staffing, and childcare. But from a funding perspective, we actually love the fact that you got the CARES Act for us. That has been huge. We would not be able to do what we're doing without your hard work, Congressman Levin. So thank you for the CARES Act. It's fantastic. There's only one stipulation to that, and that is there was a timeline placed on the spending of the CARES Act money to December 30th. That's problematic for a superintendent. And the reason it's problematic is if we want to hire teachers, we give teachers a year contract. We don't give teachers a 6-month contract. That's, first of all, this is impossible for us to do from an HR perspective, but it's also a little demeaning for a teacher. We want you for 6 months, but then we don't want you anymore. So if you could extend any time, if you were to create more guidelines for funding, if you could extend those for an entire year, it would be very helpful for us. Both for the current CARES Act, if you could extend that to June 30th, and then if you bring in with the HEROES additional funding, that would be a huge help for us. So I know you're short on time, but air filtration, staffing, and childcare is.
I got it. I took notes, Dr. Doyle. I promise. Air filtration, staffing, childcare, flexibility with the timeline. And Robbie Farewell, who's on this call, I know will be following up with you and your team to make sure that to the extent that there are efforts out there, I know there are with things like the childcare and the staffing as an example. But the air filtration, that's really interesting. Obviously when we build these buildings, I know that everybody does their best with the information they have at the time. But very, very good points that you raised. And want to thank you for joining us. I know you have to go, but I love your background for two reasons. One, it's a beautiful beach. We're honored to have, I think, the most beautiful beaches anywhere here in the district. But two, I love the slogan, we're all in this together, because it is so critically important that we don't lose sight of that. And I thank you on behalf of all of us for everything you're doing for all the children in Vista, and let us know how we can help, continue to help. And you just gave us some good ideas here. So thank you. All right. Next up, I want to introduce a good friend of mine, Mr. Roberto Rodriguez. Roberto is a high school teacher and a board member of the California Teachers Association State Council of Education. He teaches government and economics, two pretty important topics these days if you are somebody like me that thinks we need more civic education in the schools. at Otay Ranch High School in the Sweetwater Union High School District. Mr. Rodriguez, thank you for joining us. It's nice to see you, and the floor is yours.
Thank you, Congressman Levin. It is a pleasure to be here. Thank you for providing the opportunity for this dialogue. I think it's very, very important. You know, a lot has been said about where we stand and what the needs are. You know, I think it's important to emphasize one of the things that we've mentioned. First of all, thank you for the CARES Act, I think, and your work on that and getting that through. I think that allowed school districts to get through the you know, that initial stage of the pandemic and make some incredible transformation of our education system, which I want to highlight because very few people, you know, talk about this. In a matter of days, right? In a matter of days, back in March, we transformed our education system from a classroom-based, you know, in-person system that we've had for, you know, over 100 years into this distance learning environment that we're now currently in, with very little preparation, with very little, you know, lead in, and we did it. You know, it wasn't always smooth and it wasn't always perfect, but it was pretty impressive and pretty amazing to see. And that was really due to a lot of the hard work of our school districts, but in large part due to the hard work and the love of our teachers for their students. So I just wanted to mention that before we go on. So we want to talk a little bit about some of the challenges. A lot of them have already been mentioned, right? We've talked about the digital divide. We've talked about the situation with you know, students not having access to high-speed internet. You know, there are districts that are lucky enough to be, as Eric mentioned, one-to-one school districts where students have the devices that they need. But as we found out, they may not always have the internet access that they need. The other thing we found out, especially, and I'll go further, you know, down to San Diego City schools, there's a number of our kids that, you know, we live in a country where 1 in 5 children live in poverty, and some of them in abject poverty. Homelessness is a big issue. And so where do those students plug in those devices just to charge them? That's a big challenge that we're facing. And in a public school system where our charge is to educate all of our kids, that's an issue. That's a problem. How do we reach all of our children? And so I think that's important to deal with. The other issue, the other big challenge that has already been talked about, but I'll just highlight again, is the notion that some of our curriculums don't necessarily translate into this, you know, distance environment, right? That we're in right now. So, for example, I could probably teach my government class in a distance learning environment, not a big issue. But what about the art teachers? What about the music teachers? What about the band teachers? How do we do those, right? And it becomes a major challenge. You know, in the lower grades, I'm a high school teacher, but in the lower grades, some of the reading curriculum that school districts have adopted don't necessarily translate into online learning. It's almost impossible for them because the materials that they use and the equipment that they use isn't necessarily, doesn't lend itself to this type of learning. You know, there's a challenge with synchronous and asynchronous learning, right? Asynchronous teaching. It just creates a lot of additional preparation time. It creates a lot of issues. I've been hearing from a lot of our teachers in the last week since school started, just simple things like, you know, attendance and tracking how you're dealing with students and how you're, how the level of engagement of students, and are they showing up to classes, and are they turning in materials? These are big concerns. And now we're facing the issue, since we've gone to California has gone to this more nuanced kind of color-coded risk assessment levels. As we know, San Diego County is now in the red zone, not in the purple zone anymore, which means if we stay in this red zone for a couple of weeks, then school districts can start thinking about reopening. Well, I just want to caution us to some of the false expectations that being in the red zone means we're free and clear. Red zone is still a high risk level, right? It's still a situation where we still have high risks involved. And you know, the protocols and the safety protocols necessary in order to keep everybody safe, you know, have already been talked about. I mean, I wish we had the clear guidance that I wish everybody had the clear guidance that we just heard from Dr. Patterson in terms of the chalk situation, and just take those learnings and put them into practice. I know that's difficult, and would be extremely expensive, but unfortunately this pandemic has been politicized to the point that we get conflicting information. Nobody knows exactly, even the science has been politicized, which is a big shame, because we don't have that, you know, that this is what we're doing, this is the policy, these are the guidelines, this is how you do it. And so there's confusion, right? There's a lot of confusion out there that we need to try to avoid. We need to remember that, you know, schools aren't like the NBA bubble, right? We can't create that for schools. Schools are porous, right? Our children are going back to their homes. We don't know who they're in contact with. We saw the statistic, 21% of children, and it's been pretty steady, right? 21% of children get infected. In a school of 1,000 students, that's, you know, 200 students. That's a lot of students that have the opportunity to spread it. A lot of times children are asymptomatic, which makes it even riskier because you don't know who's going. I have a teacher friend who takes care of her 2 elderly parents at home. And, you know, what she has said to me is, look, if I go to school and I get infected from an asymptomatic student, I won't know, and I will spread it to my elderly parents who have some major issues, right? So these are just part of our big concerns, and I hate to you know, I hate to bring it down to the issue of money, but we all know, right? In order to have all these safety protocols, to look at the closeness required for instruction in terms of that human element that Eric was talking about earlier, in terms of how teachers, especially in the lower grades, when you know, a lot of that teaching and socializing is you know, up close teaching. It's not lecturing from a stage, and so that's an issue that we need to look at. We need to look at social distancing in the classroom, and in some schools, some of the newer schools, perhaps that might be easier. You know, I work in a district where we have schools that were built in the 1930s and 40s, and some just recently, right? So you know, there's a big divergence in capacity to do this, the social distancing piece. Lunch, where do you have kids? As we know, lunch is a high risk situation. Where do kids have lunch? Do we keep them in the classroom? Are we going to keep them in classrooms all day? You know, that's not a good recipe for a success. You know, there's you know, schools in general are this, like, you know, there's always this continuous movement around campus, and students move back and forth, and you know, how do we do that? How do we choreograph that so that we keep everybody safe? These are major challenges, and unfortunately, implementing all of this costs money, right? It really comes down to that. We all know schools have been underfunded for a long time. We were fortunate here in California that our legislature figured out a way to keep the same funding for schools from last year to this year, and so we're able to use the same level of funding and move forward. However, that budget that was passed just a few, it feels like years ago, but it was only a few weeks ago that this budget was passed, is highly dependent on federal aid, right? It's highly dependent on federal funding, and specifically the HEROES Act, which we've been talking about all morning. I think if we don't get that HEROES Act, I fear not for this year. I think we'll get through this year. Our legislature will, has figured out a way to get us through this year. Unfortunately, what they've figured out is deferrals, right? And I don't want to get too technical here, but what that means is that we're kicking the problem down the road. And as you kick the problem down the road, Congressman, as you well know, the more you kick it down the road, the bigger the problem gets, right? So, and we saw it during the Great Recession back in 2008, 2009. You do deferrals, and that just digs a deeper and deeper hole for the future. Eric's a board member. He knows what the consequences are going to be in the future if we don't get this HEROES Act passed, because deferrals means, it just means less funding available for schools. We need to cover expenses with get creative covering expenses. That usually doesn't bode well for school districts. And it's not the ideal situation. We need to get that HEROES Act passed. We need to be able to fund our schools, and honestly, we need to figure out a way to increase school funding, because the HEROES Act would be great, but it's one-time funding. It'll get us through the crisis, but we need to figure out a way to fund our schools fully in the future, and that may mean increasing revenues for our schools. I get to be single-minded about what we need for schools. I have that privilege, so I use it, right? But as you know, I'm also running for the governing board of Palomar College, and I can see the difficult decisions that are going to have to be made in the future. And at a time, I'm sorry, I forgot the superintendent of Vista just mentioned. At a time when we need more teachers to be able to implement these safety protocols, we're looking at the possibility of cuts if we don't get the funding that we need. So I'll stop here because I know we're running out of time, and I'm probably run over my time. So I just want to urge you to I just want to urge you. I know you've been a supporter of the HEROES Act, and I know you've done your piece, and we just hope that our your colleagues from across the building are able to get their act together and pass this. It is critical.
Well, we're going to do everything we can to keep fighting for our public schools, for our great teachers like you. I thank you for all the work that you do, educating young people, particularly about government, about our civic participation. And I thank you for being a tireless advocate, not only for children, but for the public education system as a whole, and for our great teachers. We thank you, and heard you loud and clear. And I'm always a call or email away. We have two more people that I am really, really excited to hear from, because we've heard from our administrators, we've heard from our public health experts. And by the way, we have our town halls all the time where we bring in epidemiologists and public health experts to talk about the science and the facts and the data. We've heard from our teachers, but we've got to hear from our parents. And I can relate to this group as one myself, but I'm so grateful that we have two leaders of our PTA from the Capistrano Unified School District. And Campbell Unified is an incredibly important district to my family, because that's where our kids attend school. And I'm first grateful to welcome Jessica Geyer, constituent from Ladera Ranch, who serves as the legislative co-chair of the Capital Unified Parent Teachers Association. Jessica, it's great to see you. Thank you for joining us.
Sorry, I had to, thank you for having me, Congressman Levin. We're really excited to be here.
Excellent. Well, I wanted to hopefully hear your perspective about what you're seeing, what you're hearing out there. I know Capital Unified, they're talking about around the end of the month. Somebody mentioned that San Diego County is still, or now they're in the red. Orange County is still in the purple. We're purple for a little while longer. There was some confusion around that, and I know Terry is on here. We're trying to figure out exactly how that all was decided, because we were out of the penalty box, off the watch list, I think, for a few days, but because of the 3-week period, the transition from the purple to the red to the orange to the yellow, we have now, I think, till the 8th of September until we're technically in purple, and that assumes that infection rate stays below and the rate of new cases per 100,000 stays below. So hopefully that will happen. But I wanted to get your perspective, Jessica, from what you're seeing and hearing out there.
Yes, and thank you. And thank you for including PTA as one of your voices today. We are among some very, very distinguished guests. And as an all-volunteer organization of parent advocates, it's amazing to be in this company. So thank you. First, I just wanted to talk briefly. Eric Joyce touched on it, Roberto Rodriguez touched on it, but it's been a very, we have noticed in Capistrano Unified that the technology infrastructure gap is a huge issue that we are facing. Technology, we first identified it when we went into distance learning in March, and it had more to do with devices in the home and connectivity, so hotspots. Our district started distributing those to families, and we felt the effects of the digital divide and the gap. I know our state superintendent has worked tirelessly to, because it is an issue throughout our state, but he immediately started getting companies to donate connectivity devices, hotspots, and working from that angle up at our state level. But in our district, we found that the digital divide, especially starting into this new school year, the digital divide didn't really have anything to do with income, or it was a problem that affected all of our families in this district due to parents working from home. We had devices, multiple devices in a home were now all being used by parents that were trying to work. We were all using the same bandwidth at our homes. And so this kind of, it extends to all of our families, and something that is affecting everyone. And when we went to online learning at the district level, we found out what our technology infrastructure could handle, which was it put a strain on our systems. We have aging infrastructure in Capistrano Unified. Some of our schools are over 55 years old, and they cannot withstand they don't have the technology infrastructure in place. So I'm going to kind of beat the same funding drum. That again is something that we can, not every problem is solved with money, but definitely this particular situation could be for facilities, for updating our facilities. I do want to give a shout out to the CARES Act again. We did, Capistrano for the 2021 school year we used CARE Act funds to purchase $8 million worth of Chromebooks for our families. So we will be at a 1-to-1 ratio for Chromebooks in this district. Not until November, because they're back ordered, because everybody else needs Chromebooks as well. But we're working towards that. So we definitely want to thank you for your support of the CARES Act. And And really, we just really appreciate your support overall for the public education system and ultimately for our children. So I thank you. And I know Michelle needs to talk too, so I'll let her continue.
Absolutely. I'll introduce Michelle in just one second. I just want to follow up on one thing you said, Jessica, which is the facilities. And I know this is the case for a lot of our school districts. And Vista Unified, he just mentioned, our superintendent just mentioned that even the newer schools have issues with things like ventilation. But in Capital Unified, the number that I remember is 400 million in backlog of things like deferred maintenance, facilities upgrades. And that was just to get the district to meet the health and safety standards, the health and safety code of the state. So I know that is an ongoing issue. I know that, you know, different districts in our congressional district have passed bonds and done things like that for facilities upgrades. This is, believe me, as a parent whose kids attend one of those schools that's probably more than 55 years old, but a great school, don't get me wrong, a great school, but just facilities that definitely do need some TLC. I'm with you all the way on that. Anything that we can do. We do have a bill at the federal level that we can send you more information on specifically about facilities, but it's run into a Senate roadblock, shall we say. But we're going to keep at it. And in fact, we included it as part of our overall infrastructure bill that I hope we can get passed one of these days. So thank you for your comments. I next want to introduce Michelle Plossel Campbell, who is the other half of, we got both co-chairs here of the legislative committee for the Capital Unified School District PTA. And she's been a member of the legislative advocacy team for the past 5 years. And prior to serving on the Capital Unified PTA, she taught elementary school in Los Angeles Unified. She doesn't know this, but my aunt taught elementary school in LAUSD, I think for like 36 years, something like that. And the Palm Springs Unified School District, amazing. So my mom's family all live out in the Coachella Valley area, other than my mom who lives close to us. But Michelle, thank you for joining us. It's great to have you with us. And I'd love to get your perspective.
Thank you so much for having us, Congressman Levin. We really appreciate it. I also wanted to acknowledge all of the work that has gone into getting the universal feeding waiver approved by USDA. And as of the start of this week, students are now able to have access to the meals they needed again. And that waiver is huge in our school district, and we greatly appreciate your work on that. I get to cover the fun topic of special education funding and IDEA. It is the federal government made a commitment and a promise when IDEA passed originally to fund 40% of special education costs, and they don't. And it causes huge encroachment on general funds for all students. But it also means that services are then minimized for students when they shouldn't be. And we need to provide special education services based off of the needs of each individual student, and we should be providing the full services they need at all times. We shouldn't be going, okay, how can we try the least expensive first? Because often if we don't do proper early intervention, the costs balloon because we haven't provided the students with the tools they need to be successful in later grades. And so I greatly support your work within fully funding IDEA. It is a fantastic thing, and I hope it becomes part of the annual budget and not something that is just piecemeal done through CARES Act or HEALS Act or HEROES Act or any of that. It needs to be something that is an annual commitment, and if we can figure out how to fund other things, we can figure out how to fund our most vulnerable children and our special needs kids. It's something that's near and dear to my heart, but it's a matter of we need funding to pay for staffing to make sure we truly are in compliance, that we actually have the additional program supports in place. And often those additional program supports are human capital. We need a person there to be the one-on-one aid, to be in that classroom supporting the teacher and supporting the student. So that's really important. Other concerns that we have when we specifically look about reopening for our campuses are that safety measures are in place, that there is the proper PPE, that there is the training for staff, that cohorts are cohorts that stay together and are not being mixed and intermingled throughout the day. That is a huge challenge for districts and schools. And a lot of it, once again, comes down to staffing. Superintendent Doyle made the comment that they've hired 20 additional teachers and they really need 100, but they had the room luckily due to declining enrollment. We don't even have the luxury in our district to have hired those 20 extra teachers to help with this. They are trying to figure out how do they do an AM cohort and a PM cohort, and have they kept those cohorts so there really isn't mixing between children who are in different options. They've given parents a lot of options, but then the communication hasn't been clear on what those options truly are playing out to be. And so communication between schools and families is where you build that team to truly make education fly and work. And as an educator, I knew from the beginning that if I did not have a good relationship with my families, I couldn't reach my students. I needed to build that engagement and that community before I could actually effectively teach. But our districts need to really focus on that right now, because that will help build trust that we can safely have our children return to campuses and alleviate concerns and fears. There's also concerns. We had Dr. Oh goodness me, I'm sorry, I lost her name. Dr. Patterson?
Yeah.
From Chalk communicating that there have not been a lot of positive cases in South Orange County. And I'm not sure exactly of the numbers for Northern San Diego County so far. However, it's how are positive cases when schools reopen communicated, because the guidance that has been given so far is not very clear from both the state Department of Health, the county Department of Health, and even the CDC. It isn't clear on how do schools communicate that to their communities, but guidance on that, how do you communicate about positive cases? When do we close? Where is that 5% threshold reached? Is it 5% of a cohort, or is it 5% of a teacher's roster? Those are very different numbers, and it also impacts the teachers, because we need our teachers healthy and safe so that they are able to work with our kids. So it's a very valuable thing, and we really need our districts to be transparent. But the big ask that I look at with all of this is money solves some problems in education. It doesn't solve them all, but it does mean that we can afford the number of teachers we need, the staffing we need, the PPE we need, the changes to facilities we need, the infrastructure we need, the wiring we need, because while wiring is not a sexy topic when you talk about facilities, it is what makes the internet run and work. And it means that you don't have your teachers dropping out of a call in the middle of it when you've only brought teachers back to a site and you don't even have students back pulling on bandwidth yet. So these are all concerns and issues that as a parent advocate, I consider, but as a mom of two very active boys, and I have two who have a 504 and an IEP, and so I am in those trenches of how do you deal with this? And I swear I'm redoing 7th grade again, 36 years after I passed it the first time. It's a little scary, but I need our schools to be safe places, but that where we know all risks have been mitigated to the best possible outcome before we look at kids returning, and that all guidance is being followed.
Wow. Thank you so much. Well, that was really outstanding. I want to thank both you and Jessica just for your leadership on our PTA. And I can also tell you that we made it through without either of my children Zoom bombing us, which is, hopefully they're doing their work on their Chromebooks. Hopefully, I'll find out as soon as we're off here. But I just want to thank all of you. We are out of time. And I know everyone is extremely busy. I want to go ahead and wrap up. I do think we've got Colin from the Picket Fence Media and our South Orange County papers. Colin, I don't know if you had any specific questions for me or the panel before we wrap up? If you're on.
No, I don't have any specific questions. Thank you.
Thank you, Colin. Well, look, everything that I've heard, and I know Robbie and Terry have as well from our team. I want to just thank our educators. I want to thank our administrators, our parents. It's clear that we're facing some really difficult challenges here, but I know that we can overcome them if we work together, as the Vista superintendent had as his backdrop. Don't hesitate to be in touch with our office. Terry stands ready to help in Dana Point. I know our team in, I think Kyle is on. Thank you, Kyle. They are helping us in Oceanside and helping our North County community. And don't hesitate to contact us anytime. Everyone is working probably harder than ever, definitely harder than ever with regard to constituent services and casework. We're working remotely, of course, but our phone system works just the same. You can call us at 760-599-5000. Again, 760-599-5000. You can also visit our website at mikelevin.house.gov, where we've got all sorts of information. We've also got links to a lot of the COVID-19 resources. The governor's new website, covid19.ca.gov, is very helpful. The CDC, San Diego and Orange counties all have new websites that are updated quite frequently. Please, please, please practice the things that we know will help reduce community spread and further allow us to get back to life as normal to whatever extent possible as quickly as we can. Socially distance, wear your mask, avoid contact unless you have to have contact, and certainly avoid contact with those who are sick. And I know everybody on this Zoom is already doing all those things, but you're our ambassadors out there in the community, and I know that you'll spread the good word. So thank you again to everybody for joining us. I want to thank also our team for their putting us all together in this digital manner. I look forward to getting together in person when it's safe to do so. But until I see you all, thanks again. Have a great rest of your day.